David Raines Community Health Centers began very humbly. We started with one facility on David Raines Road, and then we expanded to Gillum, Louisiana. From there, we expanded into Claiborne and Webster Parish. So we've gone from that one community-based site now to 6 community-based sites offering a variety of medical and dental services. In addition to that, we've added school-based health centers offering services to the children of Cattle Parish. We now have 9 school-based health centers and expect to add more sites in the future.
David Raines Community Health Center is a federally qualified health center. Federally qualified health centers help to improve the quality of life for millions of underserved patients.
We receive funding from the health department to assist our patients.
They serve as a safety net for underserved, uninsured, and the homeless population. David Raines is also Joint Commission accredited.
The Joint Commission is a national body that accredits healthcare organizations. David Raines Community Health Centers has been accredited since 2002. And we did that because we wanted to make sure that people understood that the organization was about quality. And the Joint Commission is an organization that gives that stamp of approval for quality that's being delivered in an organization.
Mr. David Herndon Raines was one of the first black millionaires in Cattle Parish. He was a successful farmer.
He was a prosperous businessman in the Shreveport area who owned land and decided to donate the land because of his concern for residents in the Cooper Road area not receiving quality health care.
Originally opened in 1971 as the Cooper Road Medical Clinic and transitioned in 1992 to David Raines Community Health Centers, now sits on the land donated by Mr. Raines. Mr. Raines donated 22 acres of land in the Martin Luther King community that now houses several community organizations such as Cattle Community Action Agency, Shreveport Parks and Recreation, and David Raines, to name a few.
Because of his donation and philanthropy, many of the facilities that are now located on that property that he donated bears the name David Raines. In addition to that, the road that we are located on has also been named David Raines in honor of his contribution to the community.
David Raines Community Health Center provide a number of services.
We offer family medicine, pediatrics, dental, behavioral health.
We also have a patient pharmacy, which is located at our Shreveport North location and our Bossier location. We accept patients, and that meaning all patients.
It's also a 340B pharmacy, which means that we're able to receive medication at a discount, and we're able to pass that discount on to our patients. So it's a really great thing for us.
That's extremely helpful, particularly for our uninsured patients who may not be able to afford the medications that may be prescribed to them. Under our organization, because we are a federally qualified health center, we can pass the savings that we have on our patients, make it affordable, because we want patients to be able to get the medications that they've been prescribed so that they can get healthier.
We have board certified providers, and we can give you the same care that you can get from other facilities.
You know, here in Northwest Louisiana, there's a lot of rural areas where people don't have easy access to health care. And providing a place where these patients can come from all different places here in Louisiana, from Ruston, from Minden, from Haynesville, and come up to us and actually get care and basically get looked at and get checked out and receive a better smile is really important to provide.
David Raines Community Health Center services everyone. I think that's one of the misconceptions, is that we're just meant for one group of people, and that's not the case. So you could have commercial insurance, you can be uninsured, you can have Medicaid, Medicare. We service every patient, and I definitely think that's one of the best parts about David Raines, is that our mission is to provide access to affordable, quality, comprehensive care for everyone.
Providing care in the community and having providers who accept that insurance was a big gap. So facilities like David Raines Community Health Center, which is a federally qualified health center, means that all individuals have access to care.
We have the ability to do sliding scale to provide for people that don't have insurance at all, which I've seen many families that have come here that don't have the means to do that, we're still able to take care of their children and provide the quality care that they need.
We want to make sure there's no reason that they can't receive the medical services that they need.
We see everybody from infant, newborn, up until the elderly, as old as they want to come in. We take care of everything. We try and make sure the screenings are done, meaning that we get your mammograms done, we get your colon cancer screenings done. So we do just about everything that we can take care of. We take care of the dental. We have a dental staff here.
It's great to just be here with David Raines, just do dentistry, do basic dental work, just extractions and fillings and whatnot, and just go ahead and provide comfort to our patients. A lot of our patients come in, they haven't had dental work done in years, and a lot of them are really self-conscious about their smiles and self-conscious about the way that they look.
We really don't realistically think about our teeth a lot unless it's starting to hurt. I've had several of them tell me they'd rather have a baby than have that tooth pain,
Some of the common things that I do through the day is I see the patients and we make sure that they get their lab work that is needed on time. We make sure they get referrals.
When we provide care here at David Raines, I want it to be like we're taking care of our family. We don't know what's gone on with them before they got there, but our job is to serve them, care for them, provide for their children, and we want them to know that we would do the exact same thing if it was my aunt or my niece coming in, and that's how we're going to take care of them.
I do know that in a lot of our rural communities, the patients would have to go at least an hour away for dental services.
We have some of the best dentists working here. We have dentists who are willing to provide care to anybody, no matter how much money you might have or where you come from.
The teeth are a window into your whole body. We can have a lot of cardiovascular diseases that are results of periodontal diseases and things like that. Okay, so we have an idea of what's going on with you, So usually that's our first insight to some of our patients is when we first see them here in dental.
We offer full pediatric care, so that would be wellness visits for babies all the way up through school-age children in high school. We do vaccines. We manage behavioral health things. We have the privilege of being able to work together as a team between myself and our behavioral health to help with things like ADHD and depression, anxiety.
We provide psychiatric services, or otherwise you could term that as behavioral health services to children, adolescents, and adults in the community. So we provide psychiatric evaluations, as well as treatment, being medication management, therapy, and counseling services.
David Raines has made a huge impact in the communities we serve through partnerships with healthcare facilities, collaborations with the Bayou Health Medicaid plans for the state of Louisiana, faith-based organizations, and Caddo Parish school boards.
We don't just deal with, the medical and dental and behavioral health needs. We do have to kind of reach outside the boundaries, and we do have community partners that we do have a bank of them that we can reach out to say, hey, we have somebody, can you help, can you assist?
You're going to receive wonderful health care from a well-qualified staff, and our school-based health centers just fits perfectly in that mission. Many of the children who come to our school-based health centers are underserved. And so they come to us from some very dire backgrounds.
In keeping with our mission, David Raines expanded into providing quality health care at school-based centers by acquiring the first school-based center that was operated by Christus Health.
I happen to be working as a nurse case manager at Christus Health, and I'd never heard of school-based health. But during that summer, one of the case managers that I worked with was going to be on maternity leave, and so we had a counselor from school-based health come and work in her place during the summer. And so she and I worked together, and she goes, you know what, you need to be in school-based health.
A school-based health center is a doctor's office within your child's school. We can see students when they come if they're ill or they need a checkup. They can come, leave the classroom, and come see us while they're in the school during school hours.
Our clinics are located in Title I schools, which means that the families are from a lower socioeconomic level.
So I think it's important that they know that the doors are open. They're just as loving and caring as the staff, as their teachers are and the staff members are on this campus. A school-based health center has the potential to see a child from the first time they step into a school setting all the way until they graduate high school.
Over the course of the school year, we see, in the past, we've seen up to 400 different types of diagnosis in the health center. So we may see a child for asthma. We've diagnosed new asthmatic patients.
And a lot of times the children, they're just not, they don't have that knowledge of how to take care of that illness. And our staff is able to take care of that situation and to educate the child. Teach them more about asthma and about their medications, their inhalers. So we see that quite often.
We have counseling services available as well and behavioral health services. So if a child is going through an emotional time or a stressful time at school, we have a licensed professional counselor available that can see your child and offer counseling.
I could just focus on doing the best possible work that I could do. And that's what makes David Raines different. And that's what made David Raines work for me.
You can learn how to take a blood pressure, they can learn how to give a medicine, but you can't teach compassion. So that's one of the things that we look for. I look for compassionate people who are going to, whether you know it or not, you're a mentor for these children. And so whether you choose to be or not, they're looking at us, they're looking at what we do. And so it's important to me that we have people that are going to be positive role models for the students that we serve.
Miss Yolanda, she's my work mom. I can call her pretty much anytime, day, night. She'll get it done, no matter if I have a question, if I'm overwhelmed. She made my transition from the community clinic to school-based so smooth.
What we like to have for our employees and patients is to feel like this is home. We want this to be a welcoming environment where you can receive services, where people care about you and we care about each other. And I think that's the true test of any organization, is that when you come into that organization, you feel like people really care about you.
I feel like it's very inspiring. You wake up with purpose. You have to know what your purpose is in order to succeed here. And since I knew that before coming here, it made it just blend in. They pushed me. Well, I'm here alone. I don't have family here, so all I have is my work family. So they kind of gave me that family feel.
And I think that's what we try to have here at David Raines Community Health Center, is to create an environment where people care about your health care, care about you as a person. I believe that it is extremely important to understand that David Raines has existed for all of these years, 50 plus years, because of the people. And when I talk about the people, I'm talking about the people who provide the services to our community, our great staff. We have a great leadership team, competent, experienced. We have well-qualified providers, board-certified, well-trained, experienced.
I have been an employee here at David Raines for over 20 years. I have truly enjoyed working with a diverse workforce throughout my tenure here.
So I chose to work for David Raines because I wanted to use my position to serve the community. I feel like God's given me that ability, and so it's my passion to be able to do that for people.
This is really my mission, is to provide care to those in need. And I'm able to do that because I work at David Raines, and I might not have been able to do that otherwise.
For me, the greatest reward in being a part of David Raines Community Health Center is when someone in our community just walks up to me and says, "Thank you."
Seeing them smile when they come back in to see you. They were frowning when they saw you the first time, but the second time they come in, they're a little more jovial,
I think that's the most rewarding thing. Dentistry is great, but without the people, what is dentistry?
It's important to understand that this organization runs as well as it runs and has existed as long as it has existed because of the people who've come through our doors. People who've chosen David Raines and the people that David Raines has chosen. And we want people who have a servant's heart, people who are here to serve, people who care about what they do, who care about the community, care about the organization, and care about each other. That's what makes David Raines a great place to be.